Thank you very much. Thank you. Thank you and good morning. First, I want to thank Dr. Baggett and Tenet for serving as our presenting sponsor for this second year running. I'm very excited about this. I'm grateful for Tenet's pledge to make their own hospital cafeterias and campuses healthier places. I want to thank all the people here from the Coachella Valley for welcoming us back and to kick off the Humana tournament. Mike McAllister from Humana often describes this week as a serving of health with a side of golf. I'm not sure everybody here agrees with that order of priorities, but I'll take everyone's participation however we can get it. I'm grateful to Humana and to the PGA Tour for their continued partnership on this great event, and I've had, just in the last couple of weeks, conversations with last year's winner, Mark Wilson, and with Phil Mickelson and their wives about how they can become more active in doing what they believe in, which is the purpose of this conference. Today, we will celebrate individuals, communities, NGOs, and companies that have made pledges to contribute to the health and wellness of others. This is important not only because these pledges will improve the quality of life for the individuals involved, but because poor health has the potential to cripple our economic stability and our sense of common bond as a society. In the United States, we spend well over 17% of our GDP on health care. The numbers vary depending on the measurement and who's measuring, between 17.4 and 17.8%. But since no other wealthy country spends more than 12, and no other country of a population of 60 million or more spends more than 11.8, that's somewhere between $850 billion and $1 trillion every single year that we spend so far to ensure less than 100% of our people and to care for them, those that are uninsured, in an erratic and delayed way that we wouldn't spend if we had any other country's system and habits. We know that some of these costs, for example, are the direct result of our excess rates of obesity and type 2 diabetes and their attendant consequences. About 70% of adults have already developed a preventable chronic disease, which contributes to rising healthcare costs and reduced workplace productivity and premature death. And according to an article which I saw in USA Today about 10 days before November's election, so it didn't, everybody was all politics all the time, and I'm sad to say, didn't get much notice. But these economists had done a study of analyzing why wages had been flat for a decade and median family income was lower after inflation before the financial crash than it was the day I left office. Seems like a century ago, 12 years ago now. And they concluded that one of the biggest reasons was that employers who really wanted to give pay raises to their employees, even in challenging times, could not do it because they were spending all their money on health care premiums. So this is really an important thing for us to deal with. Researchers from Columbia University estimate that costs related to preventable diseases will rise by $48 to $66 billion a year between now and 2030 if the current trends continue. Yesterday, I was at a conference in Laguna Niguel hosted by Joe Kiani and Massimo, who's one of our partners here, amassing experts from all over America and all over the world to figure out how to reduce preventable deaths in America to zero by 2020. It's a laudable goal, and they had a lot of people interested in it, but I'm sure you'll hear more about that while we're here too. We cannot ignore the link between health and the economy, and it runs both ways. Last September, there was a truly heartbreaking story in the New York Times. Again, I was shocked. It achieved almost no national recognition because I think it was on the front page, but it was presented as a public health story and not a political, social story, documenting that America's life expectancy continues to rise for all groups except one: non-college educated white Americans. Non-high school educated, people who drop out of high school. Hispanic high school dropouts now have a higher life expectancy than Americans of European descent who dropped out of high school. African American high school dropouts for the first time have a life expectancy equal to high school dropouts of European descent. Unfortunately, it's because the latter have been dropping, not because the former have been rising. And if you read the story, it was unbelievable. It said that from 1990 to 2008, life expectancy among high school dropouts who were white women had dropped 5 years. To give you some measure of comparison, the only place where anything like that has happened in the world is after the Soviet Union collapsed and the healthcare system went down with it. When they went through total economic distress, there was a 7-year drop in life expectancy there from 66 to 59 for men and slightly higher for women. And the men's life expectancy had dropped 3 years. And they said there were several reasons for this: the rise in smoking, rise in obesity rates and the attendant consequences, the rise in drug abuse deaths, mostly prescription drug abuses, and the lack of health insurance. And they said that the reason the women's life expectancy had dropped more than the men's is that women's smoking rates went up way higher than the men's did. Now, I believe that it's another way of saying that a lot of these people were dying young of a broken heart because of the devastating effects of the economic trends of the last dozen years or so on them. But we have to face the fact that this is happening and that this is a part of what we need to do. These people are part of our country. They can be making massive contributions to our economy. They are parents. Their children need them to live long and healthy lives. This work we can do, whether we're doctors and nurses and medical researchers or healthcare providers or just people, is very, very important. And I bring this out because most of the other news is good. There's a lot of evidence that the childhood obesity rates have leveled off and are dropping in many places. We've got a new report since we were here last year that the agreement we made with the soft drink manufacturers to reduce the caloric content in schools of drinks served both in the cafeterias and in the school vending machines, that those calories have dropped by 90% in more than 90% of the schools in America, purely by agreement. There are more than 30 million more children eating healthier meals, more nutritious meals at more affordable prices in small towns and rural areas where they used to have to pay more per meal for these things. These practices were instituted before the new USDA guidelines came in, and I say that to encourage all of you to believe that we don't need a government solution to all these things. It's good to have the right government policies, but there are things that we can do together that we can do that will make a difference. So I'm encouraged by that. I wanted to also just mention a couple of other things. Last year, I asked everybody in this audience to get involved in some way and actually make commitments to do what we do every year at the Clinton Global Initiative. Today, there will be pledges that amount in value to $100 million to improve health and wellness that will help more than 25 million people all across America. I'm grateful to our sponsors, GE, Masimo, Verizon, Sandalphia, Catalyst Group Global, PricewaterhouseCoopers, the Greenbaum Foundation, the Berger Foundation, the Owen Foundation, the California Endowment for stepping up. I'm grateful to many of you in this audience, including my longtime friend Vin Gupta, for the commitments that you will make. But I want to take special note of one. I'd like to ask Carter Kostler to stand up. Carter, where are you? Stand up. There he is. See him? He is 14 years old. He'll be able to support us all in our old age. You listen to this. He saw a problem and solved it. The problem was that he and his mom wanted to stay more hydrated and found they drank more water if they infused it with fruit. As they traveled around town, they couldn't carry the pitcher with a strainer around. So he figured out a design for a carry-around size fruit-infused water bottle, and he manufactured it. He's also decided to donate a portion of his earnings to the Alliance for a Healthier Generation, our foundation's childhood obesity initiative. You will all receive his invention in your gift bags today. I urge you to use it, and thank goodness there are 14-year-olds who can think like this and are doing something to give us a better future. Thank you. Today, you'll hear more stories from speakers about how they, like Carter, are planning to make a difference. I hope you'll get involved because we have to turn the tide in America. And as a result of what so many of you said to me last year, our foundation has now started a new year-round initiative called the Health Matters Initiative, which will bring together individuals, communities, and companies and NGOs and philanthropists to make health and wellness a priority to improve the quality of health for people across America who are not covered by our childhood obesity initiative. We want people to make healthy changes and to try to reform systems that affect people's health. We need your help to make this a success. It will take everyone in the room and then some to really turn the tide, but we can do it. You'll hear today from people who in all sorts of interesting ways have used their ingenuity and resources, large and small, to be part of the solution. So thanks for being with us today, and I look forward to having a great day. Thank you very much.